Today we're going to talk about scalp disorders, hair disorders, and its successful treatment. What is it that we don't do when it comes to hair fall and scalp disorders? We put in all the efforts, we do all the possible treatments, we have all the bioteins and the multivitamins and the zinc, and so far we are constantly behind all the kinds of different proteins and different supplementations and different medicines and therapies when it comes to healthy hair. What is it that you really need when it comes to healthy hair, healthy scalp? What is it that your scalp or your hair is made up of? And what is it that you really require when it comes to fixing it from the root cause as per the classical text of Ayurveda? What was mentioned years ago to give healthy, shiny, long hair? Let's understand in this video. Namaste everyone, welcome to Jyovis Hospital of Ayurveda and Aesthetic Center, Mumbai. Been treating today in 50 plus countries. Patients often tell me that I have been taking the biotin, the zinc and all these kinds of supplements. We need to understand that if there is a scalp disorder, a dandruff or a hair loss because of biotin deficiency, then more likely biotin will give you a long lasting result. If you possibly have a hair disorder or hair fall because you're vitamin D deficient or B12 deficient, or the hair loss is because of so and so deficiency, then most likely that deficiency, once you take that supplement, it will help you. Now vitamin D in India, again, it's moreover on the lower side. That is not directly meaning that if you take the D, that's a treatment for your hair. No, many a times we see because there is a deficiency, you may likely be a person who's suffering from hair loss. But if that's not the case, and if you take biotin, then definitely that's not the ultimate treatment that will help you. Patients often tell me that they have been doing the PRP. Now PRP, which is platelet rich plasma, this is a very effective treatment. We see the new trend in today's 23. We see the GFC treatment, the growth factor treatment, GFC, latest method, which is again a form of PRP. We see platelet rich plasma. In this PRP treatment, your blood is taken and it is centrifuged and the plasma is obtained and the plasma is injected in the scalp. It's very important to know the blood is divided into two parts. The cell, which is WBC, RBC, platelet, etc. And here the second part, which is the most important part, which is plasma. We generally inject the plasma into the knee, into the joints to relieve pain. For skin we use it, for hair we use it. So when this plasma is injected into the hair, we see good results. It's very important to know why do patients don't get relief. It is very important to know that this plasma is also your rasadhatu, which we call it in Ayurveda. From all the food that we take, the first nourishment goes to the rasa. From the rasa, the rakta is prepared. From the rakta, the mausa is prepared, the muscular tissue is prepared, and from the mausa is the twacha. Okay, rasa, rakta, maus made, but rasa, rakta, maus and twacha is prepared. You need to know that what is hair. Hair is also coming from the scalp. What is scalp? It is a part of the skin. Skin as a whole is one part. So we need to work on the skin as well. So from the plasma, if we give proper nourishment to the rasadhatu through Ayurveda and Ayurveda protocol, we see the results of PRP is enhanced. Patients across the globe often tell me, I've done the transplant. You've done the transplant, you put these follicles over here, but let me tell you, have you really worked on the soil? You've worked on the seed, you put a good seed, but have you worked on the soil? No. Over here, Ayurveda focuses that work on the root, work on the soil, work on the skin, work on the root of the follicle to have a long lasting relief. There are three phases of hair, the anagen, the catagen and the telogen. The catagen is the transition phase, the anagen is the growing phase, the telogen is the ending phase, the death phase. So the hair must come from the telogen phase back into the anagen. The hair to be increased in this particular phase and sustained for a longer period of time in this particular phase, anagen phase, is very important. Hair will come, hair will go, but it is important that maximum of those stay in the anagen phase, after which it is, transit to the catagen and then the telogen. So over here we need to understand that we must work on the soil. In Ayurveda, it is very important to have a Kesha Vardhan Kesha Sanjan and a Kesha Ranjan Karya. The karma over here is very, very important. It's not just about the external part, but it's also about the internal system. Let me explain you that it is said as the Rasa, Rakta, Maus, Met and Asti. Once this Asti, once this fifth tissue of the body gets complete nourishment, the nourishment directly goes to the hair, the teeth and the nail. The Upadhatu of the Asti Dhatu is the Kesha, Danta and the Naka. Kesha Danta Naka, Upadhatu of Asti Dhatu. As per Ayurveda, when we treat a patient, it is Purusham Viksha. Every person is different. And as per their differentiation, as per their Prakruti, we start the treatment and first month we prepare the plasma. Second is the Rakta, Mausa, Med, Asti. The fifth month completion states that the medicine has now reached completely to the scalp and the recovery process has begun or has been completely, reached the 50%, 80% or has begun completely. So when medicine reached to the Asti Dhatu, the work on the Kesha, Danta and Naka starts. So over here, we need to prepare the Uttar Dhatus. Every month we need to create and prepare proper Dhatus. We need to give ultimate poshanas to this Dhatu. And it is very important to know that the nourishment of Asti Dhatu also depends on all the Dhatus. It is not just the first 5, but all the Dhatus. And a simple sutra is given in Ayurveda which says that do the rejuvenation of the entire system if a person needs healthy hair. Do the rejuvenation through the Rasayan Chikitsa. Give the patient the medicines like the Narasimha Rasayan, the Chavana Parasha, the Ashwagandha Valeha, the Vrishya medicines, the medicine that are aphrodisiac, the medicine that are doing the rejuvenating karma, which is the Rasayana karma. So over here, when it comes to really fixing the roots, it is not just about using a hair supplement. It is about choosing Ayurveda to work on the root cause. Ayurveda is the one and only ancient science and the one and only science that has 100 plus herbs, 100 plus different therapies and 100 plus different kinds of protocols. Right from Vidya Karma to the Agni Karma to the Nasya, Shirodhara, Shiro Pichu, Shiro Basti hat is prepared, Shiro Pichu is over here, Shirodhara is given. So different kinds of protocols just for the scalp. Patient, sees the changes with these different modalities explained in Ayurveda, and medicine, it starts from 100. You can say endless different combinations and herbs are given in Ayurveda, right from Vata Ankur to the Punarnava to the Bringaraj to the simplest that we know is Avla. So several different combinations explained in Ayurveda. Today we see across the globe, doctors using the Active Ved India Kesha C Med tablet and Kesha C Med hair oil. So Kesha C Med does the Kesha Vardhan, the Sanjan and the Ranjan. It has the Bringaraj, the Punarnava, it also has the Mandur, it also has the Karanja. So right from the antibacterial action to the antifungal action, right from taking care of the dandruff to the scalp psoriasis, to the hair loss, to the baldness, to the regrowth of the hair, the Kesha C is something that has been prescribed by doctors across, by me myself again, and this is very effective. Patient needs to know that the treatment for hair is beyond supplements. Patients often tell me that they've been using this medicine called as minoxidil. It's a spray and they get relief till the time they use it. Once they stop, the hair state, the condition goes back to minus, not normal, not zero, but minus, where the hair loss or the baldness is more than what it was in the past. And many a times it doesn't suit these patients. Over here, it is not about the external treatment, it is about rejuvenating it from within. The Shastrakars, the Acharyas tell us, Rasayan, do the rejuvenation, do the Shuddhikaran, do the Vaman Virechan, the Basti, Nasya, Rakta Mokshan, apply the Jaloka Ucharan, do the Prachan Karma, do the Vidya Karma. So all these different kinds of treatments are super safe, they are effective, long term they can be followed by the patient and it gives healthy, long and shiny hair. So this is the approach of Ayurveda. Although there are different kinds of treatments in the world today, right from a PRP to the stem cell therapy to the eye helmet to the acupuncture to Ayurveda, there are endless treatments. I would say consult a classical Ayurveda doctor for long lasting result. Of course, the aesthetic treatments are very effective, but you need to know that first you need to prepare a base. We need to work on the soil, and then if needed we can work on those seeds through the different kinds of GFC and the PRP and the mesotherapy and the stem cell therapy. So over here, choose a classical Ayurveda practitioner to make sure you get healthy and happy life and healthy and long hair. So any doubts, any questions, I would like to hear from you, and I would be very happy to answer them. This is all for now. Until next time, from Jyovis and the team, look impressive, be progressive.